Thank you. So, I'm now going to ask the rest of the panel to answer their questions. I forgot to say my own question, actually, which was, why did I write my report? So we're going to start off with I'm delighted that we're starting off with Dr. Laura Marshall-Andrews. Dr. Marshall-Andrews is the Senior Clinical Partner at Brighton Health and Wellbeing Centre. She won GP Innovator of the Year in 2014, and the Wellbeing Centre was a finalist in the NHS Kate Granger Compassionate Care Awards in 2016. The practice has been recognised by Prince Charles, Simon Stevens, and the Secretary for State for Health, Matt Hancock, at a meeting for their contribution to social prescribing and arts and health. So the question I have for Laura is, why should doctors be interested in arts and health?
Thank you. Is that working?
Yes.
So I was going to start this talk by talking about how engagement in arts has a measurable physiological effect on your body. And I was going to talk about telomerase levels, DHES levels, and other things that we can positively measure to see how arts interventions affect us. But I've only got 6 minutes, so I'm not going to do that. I'm just going to talk briefly about some of the key points that I think we need to, and most of them actually are in line with your report. But essentially, I believe that doctors should be interested in arts in health because arts intervention prevent, treat and cure disease. So personally, I've seen arts interventions do better for many patients than any medication I could have prescribed. We now run, we have done for the last 6 years, a practice where we have an arts program running. And we've got 9 different arts strands there, everything from photography, walks, to drama therapy, art therapy, singing groups, narrative workshops, and digital coding. I just wanted to tell you a story about one of our patients, which I think exemplifies the benefits of arts in health. And this was an old gentleman who's in his 80s, and he's suffering with early dementia and vascular disease. And he started coming to our singing group, which he absolutely loved. It prevented isolation, it helped his mood, and his engagement in all his activities increased. He then had a stroke and went into hospital. He came back from hospital in a hospital bed. He had very significant contractures. His head was down and he was really unable to communicate at all. He was on quite strong antispasmodic medication, and then he was on medication to counteract the side effects of that, and he was on high levels of antidepressants. He came back and his wife and I were wondering what we could do to try and improve his quality of life. And when I got back into the practice, the singing group happened to be there. And one of the ladies asked me how he was doing. So I said, well, he wasn't doing that well. And she said, well, would he like us to go up and sing with him? So I said, I'm sure he would. And his wife contacted them. And 3 of the people from the singing group went up and sang with him. And they did this 4 or 5 times. And the change in him was astonishing. He was sitting up, he was engaging, he ended up having his 84th birthday party. He was talking to people who came, and that intervention did more than any medicine I could or would have prescribed him. So I think that, for me, shows how these interventions are not the soft stuff that in medicine we've always kind of slightly put to the side. They are the key centre stone of how we should be treating patients. And arts interventions are not just good for patients, or in fact, because they're good for patients, they're also good for doctors and for our health service. So we've recently done some number crunching on some of the programs that we run, and we've shown that there's consistently about between a 30 and 40% reduction in GP appointments of people who are going through or have gone through the arts programs, which is a really significant reduction in a time where primary care is very overstretched. And as Alistair was saying, I really feel in Brighton and Hove that we should be leading on this. There's an increasing national agenda about the interaction between arts and health. And in Brighton and Hove, we are perfectly placed. We've got a huge amount of arts. We've got a general population that tend to be more engaged with the arts than lots of other places in the country. And we've got a model within our practice of how this can work that we can build on. So I really hope that the agencies involved in developing arts and health allow us to capitalise on this.
Thank you very much, Laura. So I'm very pleased to introduce Jo Crease, who is the Chief Executive Officer of Impetus, an award-winning loneliness and isolation charity that creates connections that change lives. They do this through befriending, social prescribing and volunteering services in Brighton, Hove and beyond. So our question for Jo is, how can we make this happen at scale?
Which I thanked Alistair for giving me the most difficult question. So social prescribing, what is that? Basically, it's about linking patients primarily with activities or support within their communities that can help them improve their health and well-being. It's a very kind of person-centred process. It's all about understanding the patient, listening to them, and our process is designed around putting them and their kind of expressed needs at the heart of that. So we use a guided conversation and we make a facilitated referral to help people access those community-based groups or services. Why does it work? Well, at the heart of it, it works because people are listened to, and it works because the relationship between the link worker who does the social prescribing and the person themselves. And it works because there's time, there's many sessions or several sessions where people are able to be listened to and have their needs really understood. And not just in terms of their health and well-being, kind of what they were referred for, those kinds of things, but in terms of what the barriers might be to them getting involved with other activities. And very often it's things like confidence and those kinds of barriers. I used to do such and such a thing, but I couldn't do that anymore. And we spend time with people helping build confidence and resilience and ability to engage with those things. I wanted to give you a couple of examples, and the person I chose, I actually brought her quote but left it tucked away in my pocket, so I'll have to try and remember her words. This is a woman called Yvonne who we've worked with over a while, who's actually really involved in our organisation now as a volunteer. She's an artist herself and has PTSD and depression, and she had found herself unable to get herself out of that place that she was in on her own, and her GP thought that it would be that social prescribing would be suitable for her. And she says she describes the thing that had made the biggest difference was the relationship that she was able to build with Alex, and that Alex was able to build with her, who's her link worker. And they met in a cafe because she wanted to go out and feel normal, and he brought some information. They talked through it. And she has been going to groups. You know, she wanted to find something that was interesting and challenging, but not too much. So she's been going to groups, she's been exhibiting her work, she's become the trustee of a local charity, and she describes herself as having been able to take those steps for herself. And Yvonne's story is really, there are a lot of commonalities in her story compared to others that we see. You know, the main reason for referrals to us for social prescribing is isolation, social isolation, and the second most common reason is low mood. And after that, we have a kind of array of debt advice, housing advice, money advice issues that come after that. The main referrals outwards that we help people access groups, it's social groups and social activities. We don't have a very large kind of referral rate out to arts activities, interestingly. I think it's partly down to the way that we measure it, and we certainly refer to specific arts organisations and then indirectly via other services. And I think that there's an opportunity there. So in terms of the scale and how we do this at scale, I mean, social prescribing is one way of helping people access more arts and culture activities that can help support their health and well-being. But I don't think we can talk about those things without thinking about the challenges, and we can't think about the challenges without thinking about the social determinants of health that you've already mentioned. You know, a house, a job and a friend are the things that you need to be happy and healthy. And for a lot of people, the house and the job are really bloody difficult. And 10 years of austerity has impoverished our society, not just economically and financially, but also artistically and in terms of health. And those things are intrinsically linked with each other. The complexity of issues that we're seeing people referred with now is over the last 5 years since we started the service and having developed it with GPs locally and the CCG, the rate of referrals of complex cases where people have 2 or more issues has gone from 6% to nearly 20%. You know, and this is also an indicator of where there are gaps in public services. And by the way, I'm pointing the finger squarely at national government here, not our local colleagues. You know, the mental health kind of aspect of this, people are referred with isolation and low mood. You know, there is a massive waiting list for mental health services, and sometimes they're not available at all. And it's really important to know that social prescribing and activities like the kinds of things that Laura have described, they really, really help people, but they are not to be done in isolation in the absence of the rest of the support that people need, both clinically and in terms of kind of social and economic support. I would absolutely agree that this is not the soft stuff. You know, this is really absolutely fundamental to people improving their health and well-being. But the evidence and the money is all driven around savings and efficiencies. And if you can't prove that you've made an efficiency saving, then those arts activities are very unlikely to get funded. And that's a conversation that we need to have at a wider level. And if the local kind of centre of excellence can amplify that message and try and flip that around a bit, I think that would be a really useful thing. In terms of opportunities, Alistair's already mentioned the infrastructure. You used the phrase in your report, the cultural infrastructure, which I quite liked, and I wholeheartedly agree that we have a great deal of that in the city. And we also have a fantastic voluntary and community sector. I think the latest count is 2,330 voluntary and community sector organisations in the city, all doing a variety of things, all keen to help and to work in different ways and to work with new partners to find new ways of addressing existing issues. We need to think about funding those destination organisations, though. So social prescribing is a way of getting a patient involved and support them to get involved in those activities, but it doesn't resource those activities themselves, and we need to find a way of doing that. And we do have opportunities with the social prescribing work as it develops. It's kind of very much the policy buzzword of the moment as we develop that, and we've got a great base to build on in the city after 5 years of doing that together. My final point really is, what do we mean by scale? And who do we mean by them? I mean, people and patients. It's not a one type of person or one type of issue. But do we mean scale as in bigger? Do we mean more? Do we mean the same amount of money spread a bit thinner to see if we can make it stretch a bit further? Or do we mean different types of activities and innovative ways of reaching people? You know, new people or different people, more diverse people. That I think would be something really worth investing in. Thank you.